Alrighty, hello everyone, and welcome to SCO's October webinar on the wide world of optometry. Thank you so much for joining us. I hope you all are staying safe and healthy. My name is Avery Cunningham. I am a Student Services and Admissions Officer here at SCO. I'm one of the admissions team members who will be answering your admissions questions and participating in the admissions process with you. Before we get started, I ask that we all use proper Zoom etiquette by keeping microphones muted unless speaking, limiting background noise, and respecting all of this webinar's attendees and facilitators. We will have time for questions towards the end of the webinar, but in the meantime, if you do have any questions or concerns that need immediate attention, please use your chat feature, which should be at the bottom of your screen, to communicate with us. Today, SCO residents, Drs. Gabrielle Crockett and Shelby May Parmley, will share their optometry journeys, specifically related to their specialties and the scope of practice within optometry. This webinar is being recorded and will be free and available to view starting next week on our website. All right, and before turning over to your individual Q&As, Dr. Gabrielle and Dr. Shelby, would you briefly just want to introduce yourselves?
Absolutely. I am Dr. Shelby May Parmley. I'm a 2023 resident in vision therapy and PEDS, which is still the rehabilitation. I am actually a 2019 grad from SCO.
Wonderful, thank you. Then Dr. Gabrielle.
Hello, I am a 2023 graduate from SCO, and I'm currently a ocular disease resident at the Memphis VA. I originally was from Michigan, so I did serve as an extern in Detroit at the VA clinic there, but I moved back down south to complete residency in disease.
Great, thank you both. So then starting off, Dr. Shelby, if you want to talk a little bit about your optometry journey a little bit more and your specialties of vision therapy and rehabilitation.
Absolutely. So I attended undergrad at the University of Mississippi in Oxford. Not much to speak of there. I got my regular old biology degree, just like many of you, I'm sure, are doing, although it's not the only exclusive degree to get with optometry. I obviously went to SCO. I'm biased. I'm actually a legacy. My dad also went to SCO. He graduated in 2001. And so that kind of seems like it leads into the next question of like what inspired me to do this. But all things said, ultimately, my dad is not why I'm doing optometry. I actually fought really hard not to do optometry. It was just certain I'd do anything else. But I did a lot of shadowing. And while I did that shadowing, one of the main questions that I asked all my doctors was, if you had a kid, would you want them to do what you do right now? And the doctors at the time who said yes were all optometrists. So it was a pretty easy decision for me. And let's see, I can kind of just keep going down the question line. My experience in optometry school was honestly, it was the kind of the last full optometry school experience before COVID had an effect on schooling. And so I graduated in 2019. My experience was excellent. It was a huge growing time. I thought college had taught me how to study, and you have to relearn every other level of schooling you enter into. You get into high school and you relearn how to learn, and you get into college and you relearn how to learn. And optometry school is another level of relearning how to learn. And it's made me a better doctor because you're not going to stop learning once you're graduated. That's not where it ends. So what optometric specialty am I studying in my residency? I'm doing VT PEDS, which is short for, we say that very quickly all the time, but that's vision therapy and pediatrics. So I work with a lot of kiddos, and I work with a lot of people whose eyes don't do what they want them to do in terms of moving, depth perception, working together, talking with the brain, either because that's how they were born, or because of a head injury or stroke, concussions, all of those little things, even simple things like, yeah, my eyes do pretty well. but not as well as I want. You know, there's such a thing as sports vision therapy, not something that we do as much, but it's definitely in there. So that's what I do. That's my optometric specialty. And pediatrics, of course, is working with kids. I love working with kids. One of the things before I did my residency, was I was spending a lot of time with people whose ages were adult ages, but their development was such that we were still in kind of a pediatric zone. And that's a big, big thing for me. I really, really enjoy working with that special needs, developmental difference zone of patients. It's really one of my favorite things to deal with. And I guess that kind of is why I chose this specialty. It brings me a lot of joy and a lot of satisfaction. I go home at the end of the day feeling very, very good about what I was able to do and who I was able to interact with, and that I'm influencing them in positive ways, even when it's hard. I guess personally wise, one of my big influences, the reason I got into vision therapy really at all, was one of the things you can do in optometry school is you may be able to take something called seminar, which is a chosen class in a way. So a little focus. The focus that I got to choose was special needs exams. And it was taught at the time by Dr. Alicia Gross. And she had an amazing class talking about vision and development and special needs and how that all intertwines, and vision therapy for those kiddos, and how we change vision therapy and how we off-road and stretch with those kiddos. And that changed how I looked at what I could do with my life. And it was that's kind of the turning point for me. That's when I really chose this specialty. What systems, diseases, patient types, or procedures are part of this specialty? As far as diseases go, the stuff we see, again, is more that systemic, either the special need or this is how I was born, or something bad just happened. So we either just had a stroke, or we have always had an eye turn and we're trying to get that eye aligned again, or I've got one eye that doesn't speak as well with my brain, and amblyopia, where the eye itself is completely healthy, but for whatever reason, the brain has decided not to communicate with that eye as well. So those sorts of diseases, yes, but more conditions or things that you were born with. And those are the types of patients I see. Oftentimes they're very young, but sometimes I get much older or in the 20 range, again, with that head injury and that sort of thing. I still practice with pediatrics, full scope optometric care. So anything you would have learned or would choose to learn in optometry school, I still do. I'm a firm believer in practicing to the fullness of my scope in whatever state I'm able to be in. So I still see a little bit of everything, despite the fact that I definitely focus in on vision therapy and pediatrics and spending that extra time with patients who have a little bit of extra need for whatever reason. What kind of relationships do ODs and this specialty have with their patients? It really is special. And that's, pediatrics is one thing. I get to sit in the floor and having the exam with the kids. And, you know, sometimes it's messy and sometimes it's screaming and crying, but sometimes it's hugs and play and just super excellent rapport. And especially with vision therapy, you build a really, really special, incredible bond with your patient. And because you start out with them when they're not feeling so good or not doing so well, and you build with them and celebrate with them over time. And that's just wonderful. It's hard to beat that kind of connection with your patients. And it's something that I don't get to see when I do just regular full scope. I really do treasure my time with my vision therapy patients. How often do patients surprise me? Often, a lot. They surprise me a lot. there's a lot of stuff that works exactly like you'd expect it to. A convergence insufficiency patient, which is a patient who can't bring their eyes together near the way they want to. Um, they work just like they're supposed to 80% of the time. But then you add one little funky diagnosis on top of that, and all of a sudden, nothing that we want to work works. um, and then you're off-roading. And I love off-roading. There's this really nice, convenient VT. There's VT that's proven, um, and there's VT that is sort of, well, we're just going to have to figure it out as we go. And that's kind of my favorite thing. So very often I come across something I'm unfamiliar with, and kids also are not immune to bad things happening to their eyes. I've had ear drops put in eyes, penetrating injuries for kids, really weird stuff in the back of the eye. You still see disease and damage and those sorts of things. They still happen. It's just that my world tends to center around how a kiddo grows, and what do their eyes do and how do they talk to a brain as they grow. Oops, I already answered the next one. What do I find most rewarding about this specialty? It's the progress and the relationship, and that it's not one and done, and it's not once a year and done, and it's not every 3 months. Oftentimes I'm seeing my kids once a week. It's satisfying. It's progress you can see and feel, and it's stuff that the kids feel. As their reading gets easier, they get really excited, or they figure out how to throw and catch a ball, and they couldn't do that before. And I get drawn pictures and hugs and good stuff, and that's the best part. Significant challenge. It's not that it's a tight-knit field for the most part. Vision therapy is a pretty tight-knit subfield of optometry. But I would say that it is, there are plenty of disagreements. There are plenty of ways to view how brain and eyes grow together. And plenty of people that will disagree with me, and how I've decided my model of vision works. And there's just, for every person that you hear that you're like, yeah, that sounds good, there's another person that you'll say, yeah, you know what, that sounds good too. And they're very, very different. So honestly, the most significant challenge is continuing to flex and grow, because this field is still flexing and growing and changing. And so that's probably my biggest challenge, is I really want to dig in, like, yeah, I know what I know. But I have to stay flexible and say that, you know what I know for now, and I can almost guarantee that I'll change as I keep having years with patients, and as more research comes out, and as more time goes on and we spend more time with patients who are unique. It's hard to ask a resident how balanced their career and personal life feels right now. Will it be very balanced? I mean, I think I have all the tools I need to achieve that career and personal life balance. Was school a good personal life career or personal life school balance? I mean, it was very, very busy. I spent a lot of time studying, and I worked very hard. When I was out in the field in Minneapolis, I studied very hard and spent a lot of time in my office. And now, as a resident, I study very hard and spend a lot of time at the clinic. But I'm in a hard growth period, and I think that that's what I should be doing. I think that this balance it's not exactly balanced in the sense that they have the same effort put into them, personal life and career, but I think it's the right balance for right now. It's the correct balance for who I am as a growing doctor still. How do I see this specialty impacting optometry as a whole? Oh, man, I can't wait to see how it impacts optometry as a whole. I think we're on the edge of really understanding why vision therapy does some of what it does, and also finding more things to do. It's becoming more accepted to do vision therapy in a wider scale. We're becoming more aware among occupational therapist and speech therapist. I worked in an interdisciplinary nonprofit in Minneapolis, and the potential is huge. If we can just, get our data right, we'll be in a really good space to grow and grow and grow. For optometry, I'm excited about where we could go. Would I choose a specialty again? 100%. Yes, absolutely. I've been incredibly lucky to work with some incredible people, Dr. Gross, Dr. Bubba Steele, we have Dr. Mays now at SCO, Dr. Taub and Dr. Schnell. For my externs, I was able to work with Dr. Randy Schulman in Connecticut, and she's also just phenomenal. I've had unbelievable luck. I don't think I could roll the dice again and get as lucky as I did. So I'm very, very, I would choose this specialty again and hope that I would get as good as I got this time. And would I recommend that you pursue a residency? Well, it's early in the decision process for you, right? You're still thinking about this whole optometry thing, and that's totally fair. I would say keep your mind open to residency up to the bitter end. Honestly, in my first couple of years, I couldn't even fathom being a candidate for residency. And by the time I was in my fourth year and I'd finally started cementing what I wanted out of optometry, it still took time, really, to get to the right space so that I could do residency the way I needed to. And I'm, again, so glad that I got this opportunity. I practiced for 3 years before I turned back around and went, nope, I want to do it again. Let's go back. And there was, luckily, the post-match had a huge gap in vision therapy, and I had a spot, and then just enjoying my great and wonderful luck ever since. So keep your mind open to it. I'm not saying it's magic and that every single one of you should do it. I'm not even saying every single one of you should do optometry, but I think every single one of you should entertain it and dig in and see if this has any aspect of any specialty that could make you very happy. Because there are certainly big parts of it that make me very happy. And they have absolutely nothing to do with what my dad does. He's a big small town disease guy, totally different from what I do. And I was able to carve out a space that's just mine and makes me happy and very on its own ways. So I think that's all I have to say.
All right, Dr. Shelby, wonderful. Thank you so much. Yes, so if you can, please hang around and then we'll have some questions from attendees at the end. But if you do have to go, then to all of our attendees who would like to pass on any specific questions to Dr. Shelby, just let me know, Avery Cunningham, and I'll be sure those questions get to her if you're not able to ask them at the end. But moving on to our next guest, Dr. Gabrielle Crockett, who specializes currently in ocular disease. So Dr. Gabrielle, on to you.
Thank you. I appreciate it, Avery. And thank you, Shelby, for all of your remarks. I think vision therapy is really special. And as you're going through school, you find that some of your classmates are really passionate about it and others are a little intimidated by it. And for me, I was always more geared towards disease, but to have practitioners that we can refer to who are really well versed in pediatric VT and brain injury and all these different areas, it's wonderful. So thank you for all of your thoughts. Okay, so to get started, I kind of said earlier, I attended undergrad at Michigan State University. I graduated in 2019, and I had my major in human biology, similar to Dr. May. I had a minor as well from undergrad, just kind of in business and that background. And then I went on to optometry school at Southern College of Optometry. I applied to 3 different programs, and being from the North and the Midwest, I wasn't sure about moving to the South, but for me, SCO had a really special feeling, and it was my first interview, and I kind of just knew right off the bat that's where I was going to go. Which kind of leads into the next question of what inspired me to pursue optometry. So this is a great question, and for those who go on to apply to optometry school, this will be a question that you get asked almost at every interview you are invited on. For me, I always wore glasses from a young age, and so I guess I was exposed kind of to optometrists as a young child, and then I knew I wanted to do medicine, and I wasn't sure if I wanted to go to medical school or optometry school. So I shadowed doctors while I was in high school and undergrad, and I was able to appreciate kind of the relationship between optometrists and their patients. It is really unique. I think being able to see the patient one-on-one and spend that, 30, 45 minutes with them on an annual basis or more frequently, it really creates a special relationship. Patients trust their doctors, they trust their eye doctors with, their systemic health and their ocular health. And I just saw a lot of work-life balance within this field as well. Which, of course, in the beginning of your career, you might not have, but you work towards it as you continue to grow. And then also just the reward of being able to kind of see patients back over their lifetime, even for someone like myself, when I was a young child, I still have a relationship with my optometrist and um, just the life-changing things that we were able to do together and getting fitted into contact lenses and everything like that. And then what was my experience like in optometry school? So I really enjoyed optometry school, different than Dr. May. I had a COVID experience in optometry school. So my first year was normal. We had, social events. We had in-person classes, in-person labs, everything like you would expect. And then, of course, 2020, everything kind of changed. And I think in a way it made us better doctors because we had to really adapt to having the same lab partners and kind of just the online learning style in general. But it was definitely very challenging, took a lot of diligence and focus, of course. But when it comes to optometry schools in general, there's really not a bad school in the country. So wherever, you decide is your best feeling, I would say go with that. Go with the school that has the reputation that you also want to have when you graduate. Know that the time kind of goes by slow, but it also goes by fast at the same time. So, when you're in it, you're probably going to wish the time away, especially during boards and kind of the stressful moments of studying and taking practicals. But you will graduate with that solid foundation, whether you do a residency or not. So, picking an optometry school that you really feel good about the program and even talking to other students or residents that have graduated from the program, that really is the best way to learn about it. Okay, so which specialty am I studying? So I'm an ocular disease resident at the Memphis VA. We are a outpatient clinic, so I worked at a hospital as an extern back up in Michigan. This clinic is similar in that we are still a regular medical office. We have a primary care suite next door, but we see all outpatient here, which just means the patients are not coming from, necessarily the ER or other in-hospital locations. So why did I choose this specialty? For me, I was always interested in ocular disease. I would say the only other specialty that I was kind of considering would be contact lens. And, when I was looking at it towards the end of my fourth year, I just kind of came to learn that there was a lot about retina, glaucoma, kind of all of these conditions that I still had yet to kind of see and experience. And I think if you asked anyone, who graduates optometry school, really it's just experience that makes you a better doctor and being around other residency trained individuals, I knew that I wanted to do that. Um, I think going off of why did I choose this specialty also brings up why did I choose residency. So I chose to do a residency because I wanted to do the next level of training so that I could enter the field with, full confidence that I can identify and treat and manage full scope disease. Every state is going to be different. So for Tennessee, we are able to do different procedures than you would be able to do in, say Michigan or Ohio. So I definitely wanted to be in a VA program where you practice to the scope of your license. regardless of where you are. So for me, I have a Tennessee license. I'm practicing in Tennessee. But if I wanted to work at a different VA, I could still work at a different VA in a different state, but I would still practice under a Tennessee scope. So it says, what systems, diseases, patient types, and procedures are part of this specialty? So, I mean, of course, you're going to have your bread and butter hypertension or high blood pressure, or your diabetic patients, um, cataracts, all of the normal kind of quote unquote age-related changes. Um, However, depending on where you're at, you do see some more zebra type conditions or the kind of outlandish things, which as a learning doctor is great because again, would I want to be seeing some of this stuff on my own? Maybe not at this point in my career, but I have so many bright, intelligent attendings that I can go to with difficult cases or difficult interpretations, and they're able to provide their thoughts and their experience. And again, that's just another reason why I enjoy residency. What patient types do we see here? So for the VA systems in general, they're going to be more of that kind of 55 and up male. You find that there are females, of course, there are younger patients, but they're just not the norm. And the procedures. So the procedures that we perform as residents here, of course, include kind of the primary care stuff that you'll learn in school and you'll be tested on and you'll feel really good about. But we also do advanced procedures. So we perform fluorescein injections, which is an IV that you instill in the hand, and then you put a little bit of dye into the IV, and it's able to travel to the eye and illustrate the vasculature of the eye a little bit better, especially for patients that have diabetes or kind of concerning vascular conditions. That's a very useful procedure. So we do perform that here. And we also do, different types of like removals, like lid lesions for, we call them lumps and bumps. So we do perform those as well. What kind of relationships do ODs in this specialty have with their patients? So, I mean, similar to what we were talking about before, I mean, it's a very trusted, I would say, relationship for the most part. Patients are always going to come in with their own story. And you do find that there are some patients that, are a little bit less trusting of doctors, but I wouldn't say that's necessarily the field. I would just say that that is sometimes on a case by case basis. So, for the most part, it's a really good relationship between the patients. I would say within the VA, they are very eager to partake in their care. They kind of know how things happen and they're grateful when you take that time with them to go through their chart and go through kind of what they've been dealing with and being able to kind of streamline their care in a way and communicate with their other physicians is really helpful. That's something I really enjoy about the VA setting. How often do patients surprise you, or how frequently do you come across something you're unfamiliar with? So I would say this is like the most important question of, looking at different specialties because I think across the board as a resident, you're going to see things you hadn't seen before. And that's the benefit of being in a residency in a way is, like I said before, you're able to appreciate difficult patients or difficult cases with the guidance of other attending doctors. But patients surprise me almost every day. I have great experiences with patients. There's very few experiences I can think of in working in two different locations now where the patients have been, you know, difficult to the point where maybe we need to get them rescheduled or things like that. But for the most part, the surprises are more that, you're seeing these rare conditions, which again, if you're in a community where patients are, relatively, comorbid, meaning they have hypertension, they have diabetes, they have sickle cell, they have, HIV, like a lot of different systemic conditions, those are all going to play into their ocular health. So from a disease standpoint, being able to see a lot of different things that maybe are rare still is really helpful. Um, for those who have any experience with patients, just a couple examples of things that I've seen as a resident. So I see like stroke patients right after they've had their initial stroke and they have experienced double vision and things of that nature. So we order MRIs for those patients to illustrate where that stroke has occurred. I've seen all sorts of ocular infections, including herpetic infections, syphilitic infection, myitis, which if you look it up online is actually a really cool condition where you have a bot fly that has infiltrated the eye and it tunnels through the retina in the back of the eye. And I was able to present a case on that at Academy this year, which was really cool. Not cool for the patient, but they had great vision and were asymptomatic. So it was sort of just an incidental finding for them. Um, there's been all sorts of kind of surprises in terms of interesting cases. And I think, everyone feels differently about that. But for a disease resident, that is what we basically go into it looking for. Um, so what's most rewarding about this specialty? I would say this is a specialty where patients, they genuinely need this care. There's very few routine exams that come through the door. A lot of times they are having complaints, whether it's that their vision is changing or that their eyes don't feel the same or they're in pain. And because of that, you're able to kind of intercept them at a point where you're getting them on treatments that really help them and really make a difference. So it's very rewarding. Significant challenges in this specialty. So I think ocular disease is a little bit more of an intimidating residency for some people just because it's very broad. Um, like I said before, you're going to see all sorts of different things and you're going to learn how to treat a lot of different things and you're not going to recognize some of this stuff right off the bat. So I would say the challenge is just being open to learning and open to not always knowing the answer, but also just realizing that you'll have plenty of healthy, straightforward people once you finish residency and you'll feel good about managing their conditions, but you'll also have a really strong basis in these medical management scenarios because you've seen a lot of different disease. Okay, so balance with work and personal life. So for me, I actually work at a private practice part-time as well. So I'm doing 4 10-hour shifts at the VA, and then I work at a private practice on Fridays, which I actually really find that as a great balance for me because I'm able to see, like I was mentioning, more of those routine exams and work on my own efficiency and just contact lenses and some of the stuff that you don't see as much in a disease setting. So I'm able to balance those two pretty easily, and I think of course, there are times that it's a little bit overwhelming with different things that you have going on, but for the most part, residency has been wonderful in terms of balance, and it depends on the program. I will say, like, do your research if you're interested in residency and try to really look into what the expectations are because there will be programs that have more of a didactic component, which just means, you have research that you're going to be doing on the side, or you have on call, or you're teaching or you're giving grand rounds, for example. At my residency here, we have one didactic conference each week on Fridays for about 2 hours, give or take. And that's pretty much my favorite part of the week sometimes because we get to see all these cool cases that everyone put together for the week, and we get to learn about different topics or different techniques. And it's just a very collaborative environment. So I find that that actually is a really big highlight of the residency, and it's not overwhelming at all. Okay, so how do you see this specialty impacting optometry as a whole? So I really think disease is very important. Going back to the scope of practice in certain areas, especially in rural communities, optometrists are the primary care providers, and they are the ones that are doing the advanced procedures. Tennessee passed the lumps and bumps law, which allows us to perform minor procedures on chalazions, which are essentially just kind of styes that are no longer infected, but still are kind of elevated, and they have not gone away on their own. So we're able to cut and remove the substance within those areas. We're able to inject steroid within to the eyelids and even within the conj, which is the clear part of the eye that kind of sits above the white portion for people who have inflammation. We perform a lot of different things, and the specialty is hugely important, not only in those areas, but just across the country. Like, surgeons need to be doing surgery. And so a lot of them understand and appreciate having an optometrist who is well trained and who knows how to manage all of the conditions up until the surgical point. So would I choose this specialty again? I absolutely would choose this specialty again. As I was mentioning before, I was between contact lens residency and disease residency, and I think making the decision that I did, I broadened my scope of understanding. Not to say that the contact lens wouldn't do the same thing. It's just that for me, the disease component is so complex and so vast that the whole year devoted to that really has been and continues to be very useful. And then would I recommend that students who go to optometry school pursue residency? So I would say that, a little bit different between Dr. May and I do believe, depending on what field you're looking to enter into, that everybody should consider a residency, because when you look at the field of optometry as a whole, the people that are leading the field are residency trained. So the people who are doing the research and, able to move us forward in our scope of practice are those who have done the advanced training. I get that, it is a year. It's a different pay structure than, going into private practice or working for corporate, but it is so helpful and so rewarding to be able to manage cases in a way where you feel confident in your decision making, your patients feel confident, and at the end of the day, it's just 1 year. So I would say if the pay is the reason that you don't want to do it, really sit down and think about kind of the differences that it offsets and the benefits in the long run. Um, all of the stuff that, the knowledge and the things that you accumulate during your externship sites, that just continues to grow throughout your residency year. You learn different preceptors or different attending doctors will have ways of doing things that are not how you necessarily learned in school, but really useful and really helpful in real life scenarios. Again, all of that stuff kind of culminates in a very helpful and augmented experience after you finish optometry school. I think you can't go wrong with whatever residency you pick, but just of course looking into kind of what the expectations are and what the day-to-day looks like, and just talking with different residents about what they do and what they're interested in and what cases they're seeing is the best resource that I can recommend. And if y'all have any questions, you guys can email me as well. I think Avery might put up our emails, but I'll give it to you here if you'd like it. It's my first initial G, last name Crockett at od.sco.edu. You can email me any questions you might have. Thank you.
Wonderful. Well, thank you both for sharing, your individual journeys and talking so much about these incredible specialties and the experiences you've had within them. That's all wonderful information, and I know our students who are live with us now and who are going to watch this webinar afterwards are going to really benefit from all that insight. So I'm turning it over now to our guests. If any of the people attending the webinar have any questions for Dr. Gabrielle, Dr. Shelby, or both of them, please do use the chat feature below. And we'll be sure to address them. I'll also put their emails into the chat feature as well. So for anyone who's watching live, we'll have a chance to reach out for them if they'd like. But while we're waiting on some questions for the attendees, this is a question for both Dr. Gabrielle and Dr. Shelby. Since you both were SCO students for your optometry school program, what made you decide to pursue your residency at SCO?
I'm not sure if Dr. May is still on the call. I decided to do residency with SCO kind of just based on talking with different residency programs. I interviewed with two other residencies. One was in Chicago in more of an academic setting, and then the VA up in Detroit. And I think just learning about what the residents felt they were gaining from the program or what they were seeing and kind of the environment was more of what drew me. And I think being an SCO graduate and doing an SCO residency, I do see that just continuation of learning. And at the same time, I wouldn't say it limits you. You can do a residency anywhere once you graduate, but I've definitely really enjoyed being in an environment where there is that SCO based learning. And a lot of the attendings here actually graduated from there a while ago. So it is really cool to grow with them too on what has changed and what they've learned over the years.
Yeah, I'll say that initially I think I was not worried to go back to SEO, but I had people in my life who went, is there no better option? Haven't you seen that already? Um, but I spent some time with the previous residents, and just genuinely, it is a different experience. It is not being a student for year 5. It is engaging in a very different way with your teachers and with your fields, having conversations with your mentors that they, you know, couldn't couldn't necessarily have with you before because you really couldn't take it then. Uh, in them challenging you in ways that go beyond, a grading system or a rubric or a pass off, just making you better in very unique ways. Um, and in those ways, I decided that the mentors that were at SEO were the ones that I wanted to get more from. And so that was a pretty easy choice once that was all laid out.
Wonderful, thank you. And we do have a couple of questions, it looks like. The first one is from Gage. It says, what was the interview process like to get into school? And I'm assuming optometry school, not specifically the residency. Were the questions personal, or do they slam you with hard questions? And what is your best advice to prepare and do well in the interview? And either of you can answer this question, or if just one person wants to start off, that's fine as well.
I can speak on that a little bit. I would say that, depending on what school you're at, the interview process is going to be different. Similar to residency, I applied to 3 different schools and I interviewed at all of them. And for me, SEO, it was the most collaborative interview. You're asked questions, of course, about yourself. And like I said, why did you pick optometry? What are your interests? What are your goals? And just kind of getting to know you environment. But at the same time, there might be schools that are going to ask you more of like your didactic or your school background and kind of how they feel that has shaped you. And it really just depends on the school, but I didn't have any experience where I felt like it was a very scary or challenging environment. It was more just kind of you're selling them on yourself as much as they're selling you on the school.
Yeah, I think I can answer this one, and then I probably need to run. I was able to hang in there. But for me, my interview process, it was very academic on the application end, stepping into here's your checklist of things to put on the paper and put in the envelope and fill in the gaps and grab your GPA, grab your OAT, all those things. And by no means am I saying don't focus on those things, because they are super important, the grades and the admissions test and all of that. But the best feelings that I got and the best information that I got in my admissions process was spending a ton of really good time at the school. And when my interview was about why I wanted to do optometry, but was also about me, and SEO trying to figure out if this was the kind of fit that they were looking for. Because that's a culture fit too, right? So having that experience was more personal than you might expect. So bring yourself to the table, who you are and all the things that make you flexible, varied, enriched. But I guess that's the main thing there.
Wonderful. And it looks like we have one other question. And then thank you, Dr. Shelby. I know you have to run, so Dr. Gabrielle, if you can stick around a little bit longer, maybe address
Yeah.
this last question.
Thank y'all.
It does. Thank you very much, Dr. Shelby. And so this question is more for residency program. So what was the admissions or acceptance process like for the residency?
Thank you for that question. I think, to be looking ahead is really important. Residency for me was a little bit, I don't want to say it was last minute because I always considered it in the back of my mind, but until my fourth year, I didn't realize the difference between what a residency trained experience and doctor is like, and then someone who hasn't. And that's not to say that it's a bad thing not to do it. It's just for me, I found that there was a huge difference in those two different scenarios in the real world. That being said, when you're applying for residency, if you do it the traditional way, you submit a application around October of your fourth year, and you do it through an OR match, which is like an online kind of like when you apply to optometry school. It was like Optomcast, I think, was the um, general application. And so this one is similar. You upload 3 different letters of recommendation from doctors who can kind of speak about you and about your character and why you would be a good candidate. They upload those there themselves. So you kind of just reach out to them in your fourth year and ask if they would be willing to do that. And I would recommend taking part 3 of your national board before you apply so that your scores have been uploaded because there is a little bit of a delay with that as well. But beyond that, it's really just writing a letter about why you are interested in the program, and then having the others speak about your background and then uploading your board scores.
All right, thank you. Well, it doesn't look like we have any other questions that are coming through the Q&A or the chat. I did put both of our facilitators and guests' emails into the chat feature, so if anyone wants to follow up with them. But if there are no last questions, then I believe this brings us to the end of our webinar. I know we've covered a lot of really great information today, and I hope this has been of assistance to all of our attendees and future viewers as you start on your optometric journey. Our November webinar will feature a panel of current SCO students discussing their reasons for choosing optometry and more specifically SCO. For our attendees, if you haven't done so already, I invite you to request more information by signing up for our inquiry form. You'll receive a personal advisor and a personal brochure with information relevant to your goals and experiences. Thank you to our guests, the doctors, our residents, for sharing their time and experiences, and a special thank you to all of our attendees who have joined us. We hope to see you all at the next webinar in November, but in the meantime, have a great rest of your week and take care.
Thank you. Have a good day.